Have you ever experienced a sudden bump to the head, perhaps from a fall or an accidental knock, and then found yourself feeling unwell, maybe even nauseous? It is a moment that can be quite unsettling, and it often leaves people wondering how serious their symptoms might be. Yes, vomiting after a head injury can definitely be a sign of an emergency and usually requires immediate medical attention. It is a critical symptom that should never be ignored, as it often signals a serious underlying issue. The primary reason vomiting occurs after a head injury is often related to an increase in pressure inside the skull, a condition known as intracranial pressure. When the head sustains trauma, there is a risk of swelling or bleeding within the brain, or between the brain and the skull. This creates extra volume in a confined space, pushing on brain tissue and disrupting its normal function. The brain's vomiting center can be stimulated by this increased pressure, leading to nausea and emesis. This is a vital protective response, indicating something is significantly wrong. If you or someone you know experiences vomiting after a head injury, the most important step is to seek immediate professional medical evaluation. This means going to the nearest emergency room or calling emergency services without delay. Do not try to wait for the symptoms to improve or attempt to self-treat. A healthcare professional needs to assess the situation quickly to determine the extent of the injury and prevent potential complications. Medical professionals will look for specific patterns such as multiple episodes of vomiting or projectile vomiting, which are particularly concerning signs of rising intracranial pressure. They will also consider other associated symptoms, such as severe headache, confusion, difficulty speaking, changes in pupil size, or loss of consciousness. It is crucial to remember that symptoms can sometimes be delayed, so even if the person seems fine right after the injury, vomiting hours later still warrants immediate care. Understanding this crucial link between head trauma and vomiting empowers you to make quick, informed decisions. Prompt medical assessment for vomiting after a head injury is not just a precaution. It is a vital action that can help ensure proper diagnosis and treatment, potentially preventing more serious long-term complications and protecting brain health.